we have our healthcare partners, GRMC, where patients are partners. They truly are. We have you guys in the studio every week, and we're very happy to, because it gives us, now that we're in a very weird situation politically with regards to our local public hospital, it helps gives us some insight, I think, with what goes on behind the scenes. And we have our friends, Rose Grino, nursing supervisor and president of the Guam Nursing Association, and Bryan Bansil, interim unit supervisor in the ICU. You guys focus mainly on ICU patients. And Rose, I'm going to ask you about the nursing standards that was recently passed into law. I know that the Guam Nursing Association was heavily involved in putting some of those standards together. So I wanted to get your thoughts on how you think that can improve services at GRMC and to our community overall. So I'm going to pose that to you towards the end of the conversation. We're really excited about it. I'm really excited about that bill passing. But for now, let's talk about the ICU. Everybody is familiar with the ICU. It's one of the most challenging areas, I think, in the hospital to work. And not that I have any experience, I'm sure you guys can attest to it. It's a lot of problem solving. But as a patient or a family member of a patient, it's one of the most difficult places to be. So tell us about some of the cases, what you commonly see in the ICU.
Good morning, Andrea. Thanks for having us here. I'm going to have Bryan, she's like in charge of the ICU, but we do have a lot of challenging cases that we see in ICU, and it's really thankful that we have now GRMC, because most of the cases before, Andrea, have you seen, there's these patients that critical care patient, and most of them we have to bring off island, because we don't have those services. But now we have GRMC, and we have the team to take care of this special population. And in details of that, I'm going to make Bryan talk more about it in ICU.
Good morning, Andrea.
Oh, good morning. Do we have him potted up? Okay.
Okay. So some of the cases we see in the ICU, since, if you look at bigger hospitals, they have specialty ICUs, but since Guam is so small, in our ICU we see a mix of patients. As you know, we offer stroke services that are new to this island, provided by GRMC. We also provide some cardiac specialty. Right now we do PCIs. I believe Dr. Wiederman was here prior, so we do offer those services previously that were not previously available on Guam. So a bulk of our population that can't get those services anywhere else on the island come to us. So probably half our patients are neurocritical patients, as well as our cardiac critical patients.
Tell us what people need to look out, because I had a friend who had like what she had felt was a reaction to maybe some food she ate or whatever, and so she went to the clinic and they said, we need to screen you for a heart attack, because women present different symptoms, right, than men. Typically, I'm like, that is so. We live in such a male-dominated world that, women still look for tingling in the arm, et cetera, et cetera. I never would have realized that, gastrointestinal problems could be a sign of a heart attack. So what could people look out for, since those are the two of the main services or the main things that people utilize in your ICU, that predominantly? So you have people who could possibly be suffering from a stroke, and what are the things that people need to look out for as far as stroke and heart attack or heart condition?
So we'll first start with stroke. So stroke is very hard to detect at first. So patients might find themselves feeling weak, or family members might find the patient acting weird, because that also could be a sign of a stroke.
What do you mean by weird? Like, what's weird?
So acting not normal.
Because we all watched House. And there's some strange symptoms that tell you they had people, like the words were coming out wrong.
Yeah,
so slurred speech.
So slurred speech, we have some slurred speech. Also, we have some emotional instability sometimes, depending on what the
Really?
stroke,
Yeah.
because it can happen. So, but you know, if any of those cases, then you would need to, see a physician or go to your emergency department, depending on how severe it is.
So as a woman, you might just think it's just your hormones, but you could be suffering from mild.
could.
I mean, if you're,
If it's drastically different from
Yeah.
your
right.
normal.
A lot of times as a woman, when you're feeling off, it's just like, we just kind of write it off as, my hormones are out of whack or something.
Or you're just tired with all your household work.
Right,
you know,
tired
that,
from
yeah,
work
yeah.
and-
Andrea, we're in a population where we had a lot of comorbid. We have a big population where diabetes. So
Right.
diabetes, usually you don't see the classic symptoms. They will just have like numbness or feeling tired. But the key to that is if you don't feel good, it's best for you to check go to have it checked with your doctor, because we do have a lot of predisposing factors here. We're high population with hypertension, diabetes, and those are really the contributing factors for us to eventually get into, a lot of hypertensive. In here in Guam, we do see a lot of patients coming in to our emergency room with a blood pressure of systolic like in the 200s.
Wow.
So, I mean, if you, the key there is, have it checked. You check it in the clinic, or if it get worse, coming into the emergency room. Because the earlier we see you, the better the management and the outcome would be.
So you mentioned diabetes. Does diabetes also play a factor in the increased possibility of stroke or heart?
Yeah.
Yes.
Interesting, because we know diabetes is a really big issue here on Guam, and I'm not quite sure where we are as far as trajectory. Does it continue to increase, or did I see more people exercising? Are we starting to see maybe the onset of hopefully decreasing diabetes? Is it all genetics? What can we do to continue to make a dent in our diabetes population on Guam?
Well, there's a lot. We really have our lifestyle, the
Right.
way we eat. It's really great that in Guam there's a lot of physical activities, the wellness program, and all this. And actually, we have a huge diabetes campaign. Even at GRMC, we have some class, but. It's gonna be a while, but
Right.
it's really need to start from home.
Right.
Young.
I'm definitely seeing more people mindful of eating fresh, less processed foods, et cetera, et cetera, et cetera. So that's interesting to note also the comorbidity could affect your increased risk of stroke and heart attack. I wanted to kind of go through, we have all watched these doctor shows, hospital shows. Like the minute you come into work, it must be chaos from the moment you clock in to the moment you clock out. What is a typical day like for you in the ICU? I can't even imagine. I think it's pretty crazy here in the studio trying to talk for 4 hours with news coming in. I can't imagine. You have so much responsibility in your hands.
Mm-hmm.
What is a typical day like for you?
So, don't believe all the doctor shows.
Oh, darn it, because it's such an interesting, it's actually kind of glamorous. Like, it could attract a lot of people to the field of medicine. It's like, I want a challenge like that.
So in the ICU, of course, it's very high acuity, high stress. So really, it's a team approach.
Mm-hmm.
So everyone in the team, from the doctors to the RT nurses, everyone's on the same level.
Mm-hmm.
We all collaborate. It's a collaborative practice. We all contribute to the patient's safety and health. And without that makes it worse for the patient if we don't work as a team. So a team approach in caring for a patient is very, very important in the ICU, just because of the illnesses that they have. Sometimes some patients require all hands on deck for attention. And I've seen it where all hands on deck, and we save the patient's life, and the patient eventually walks out.
Yeah.
Go ahead.
Yeah. Andrea, just for for our listeners out there, it's really a lot, from our CMT that watch the monitor, to our nurse's assistant, to the bedside nurse, to our intensivist, to our consultant, even me as the house supervisor, participate in the care, because anything, anytime, anything can happen.
Right.
So it's really a very it's an intense environment, but the work is good because we collaborate. We really work as a team. Well, everybody has an important role.
Right. And you've been doing this for a long time, Rose. Like,
I mean, you're a nurse for 27 years.
Right. And not just a nurse, but actively involved in keeping, nurses at the forefront of healthcare. Mm-hmm. And we did talk a little bit earlier about those standards. We're going to get back into that. But going back to that, that chaotic environment, at the same time, it's also very regimented, right? Like there are procedures by the book, that you must follow. Like, this obviously doesn't even come close to doing something in healthcare. But even when I worked in telecom, right? Somebody calls in, I have a problem with my phone. There's a whole procedural list of things that we do before we actually send that to, and so when you follow that procedure, it kind of helps streamline efficiency and the workflow for everybody else. Tell us about, you talked about how everybody fills a role. You don't realize the specialties. You just think, as a layman, I go in for healthcare, there's your doctor, there's your nurse, there's a lady who checks you in, et cetera, et cetera. But not realizing everyone has a very, very specific role. Tell us about some of the specific specialties that you have at GRMC in the ICU. Like some person will just specialize in this particular thing, and that's the person that you call on for certain items in the ICU. Like what are some of the specialties you have in the ICU?
Like I said, we are the neurocritical, so I would say that that's some of our specialty that we provide on the island. Our nurses are trained for these new equipment that are new to this island, and these are life-saving equipment. So that's some of the specialties we provide there at GRMC, who would otherwise be transferred off island, or they would just be status quo.
Right, because that's a big deal. Is training on newer equipment, and so exactly. That becomes is there a certification process when they go through the training on that specific? Is there like a specific?
So for the specific equipment, we do provide training for these specific equipment, and we have specified nurses who provide that education and training. And
see, so many specialties, right? So you have the nurses who provide the training. Just all they do is educate. Mm-hmm. There are people who are specific in the education of that particular equipment, and everybody plays such an important role. Mm-hmm. And it really isn't until I guess when you start caring for your elderly parents that you start realizing, you got to go there, you got to go there, go to this department for that, and go to that department. It's like, wow, okay, that person specifically looks at this, or that person specifically looks at that, or we bring in a particular nurse or PA to address something. So it's good to know that you have all this new equipment that people can avail of, life-saving equipment. The ICU, again, such a chaotic place, but such a fulfilling thing, I think, that you guys, when you go home knowing that you helped people, because that's a really, that's one place where you really go home knowing you saved somebody's life. I wanted to go get back into the nursing standards, Rose, if you could. Senator Mary Torres introduced Bill 201 quite some time ago, and I was trying to find out the status on the bills. Apparently, I don't believe the governor signed any of them. So at this point, we're just assuming they all lapsed into law. It passed with 15 votes.
Yes.
Tell us a little bit. She was a big proponent, and I actually had a couple conversations with her about that. I feel bringing those standards up and allowing these particular nurses. One, I think it enhances the career path, right? It enhances the career path from people who are studying nursing to go further and further and further and get educated to become full practicing. But I, for one, feel it's also an added element to our infrastructure, our medical infrastructure. Yes. As specialty doctors are hard to come by. I mean, you're lucky if you get 2 minutes in a room with a doctor, and so this allows our infrastructure, I think, to grow, so that we're not. Doctors can see more patients. Tell us a little bit about how long it's taken. I know the nursing groups have been involved in the developing of these standards.
Andrea, overall, nurses now, our role are advancing. We are doing an advanced practice, not only in Guam, but across the nation. With nurses before, looking at about 20 years, 25 years ago, our role is pretty much a lot of bedside. But now our role, because of being part of the healthcare team, the role of the nurse is really advancing. So we do have a lot of advanced nurse practitioner. And it's really exciting for the passing of Bill 201. It's really authorizing the APRNs, the advanced practice, the full practice. And this is really, what is the big thing about this? You mentioned about that, seeing a doctor, but it's being part of the healthcare team that improves access to care. And studies have shown that, nurse practitioners will be able to provide a good quality care to the patient and be part of the team. And it's part of the collaborative team. And I'm just telling you, Bryan here is a student of, he's also advancing, and one of these days he's going to be, hopefully in, APRNs. And Guam is so exciting.
I agree.
We used to only have about a handful of nurse practitioners. And now we have a lot, and we do have a lot of students. And I, for one, as a proponent of nurses and being part of the nursing leaders, is really, I am excited for this. And so we're so happy that the legislator voted it unanimously, passed that bill. So we're just waiting for the governor to sign it.
That's already, that deadline's passed, and so that's why I wanted to.
So it's really, and you see this nurses filling the gaps of care, just for preventive, and even they're not only on the primary care, and most of them they specialize in a critical area or any other area that before in Guam, this is not you see it's being involved in the healthcare team. I'm so excited, and it's just really going to help the population.
I agree 100%. There's technology that nurses now have to learn how to use, so that gets them involved. And again, career path, right? It's more opportunity.
Yes, and then also we do really encourage to our nurses to do an advanced practice. And even in ICU, we have about 8 nurses that are certified in critical care, meaning to say that they studied they took the test and achieved the level or the standard of knowledge, or achieved the level of knowledge that specialize in care of this special population. It's nice. It's for the patient,
right? It expands access, because, like I said, for the whole time I was caring for my dad, very little we saw the doctor. It was the nurse practitioners that we saw almost all the time, and so there's so many levels of care, right? And I get, you're right. It feels
we're about 39 advanced practitioners in Guam. So those are advanced practice registered nurses, that are registered in Guam, and it's exciting.
We're really excited about that, and we're really excited about how that's going to help our healthcare partners. We're patients, our partners, GRMC. Thank you for coming into the studio today. It's nice to see you again, Rose. Nice to meet you, Bryan and Cindy. This is our first time, so welcome to the station.